What are the key signs to distinguish gout from other joint pains? Imagine waking up in the middle of the night with a sudden, sharp pain in your big toe that feels like it's on fire. That's often how gout begins. Gout is a type of inflammatory arthritis caused by excess uric acid in the blood, which forms crystals in the joints. Recognizing the key signs can help you tell it apart from other joint pains. First, gout usually hits suddenly and intensely. The pain can be so severe that even the weight of a bedsheet feels unbearable. This rapid onset, often within hours, is a hallmark of gout. In contrast, conditions like osteoarthritis tend to develop gradually, with pain worsening over time rather than appearing suddenly. The most common joint affected by gout is the base of the big toe. This area, called the metatarsophalangeal joint, is classic for gout attacks. While gout can affect other joints such as the ankles, knees, wrists, or elbows, the initial attack is usually localized to one joint. Other types of arthritis often involve multiple joints at once or affect joints symmetrically. During a gout flare, the affected joint becomes swollen, red, and warm. The redness and heat are signs of acute inflammation. The swelling is often quite noticeable and can make movement painful. These signs are more pronounced than in some other joint conditions, which may cause stiffness but not such intense redness or warmth. Gout episodes tend to come and go. You might experience a flare that lasts several days or weeks, then have periods with no symptoms. This episodic pattern helps distinguish gout from rheumatoid arthritis, which usually causes persistent, ongoing joint pain and stiffness. In chronic gout, uric acid crystals can form lumps called tophi under the skin near joints. These are firm, chalky deposits that are visible or palpable. Tophi are not typical in other forms of arthritis and can be a sign of long-standing, untreated gout. Gout can sometimes involve the kidneys, leading to uric acid kidney stones. These stones can cause additional pain and complications, which are not common in other joint diseases. Unlike autoimmune conditions like rheumatoid arthritis, gout generally does not cause systemic symptoms such as fatigue, fever, or weight loss, except during acute flares. It usually affects one joint at a time, especially early on, which is called monoarticular involvement. In contrast, rheumatoid arthritis often affects multiple joints on both sides of the body, especially small joints of the hands and wrists, with morning stiffness lasting more than an hour. Osteoarthritis tends to cause joint pain that worsens with activity and affects weight-bearing joints like the hips or knees, with less redness or swelling. Understanding these signs can help you recognize gout early. If you experience sudden, intense pain in the big toe or other joints, along with redness and swelling, it's important to see a healthcare professional. They can confirm the diagnosis with blood tests for uric acid levels or joint fluid analysis. Proper management includes controlling uric acid levels and preventing future attacks. Remember, each person's experience can vary, so personalized medical advice is essential. If you have recurring joint pain or sudden flare-ups, consult your doctor to develop a tailored plan for long-term management and prevention.